GlaxoSmithKline is one of the world's largest research-based pharmaceutical corporations that discovers, develops, manufactures and markets branded human health products. Its headquarters are in the UK with additional operational headquarters in the USA, and the global presence is in about 160 countries. Its employees are approximately 108,000. In 2008, the reported sales were £24.3 billion. And in 2007 it reported net profits of £5,310 million. The company's 92 brands and 1,000 products registered a 45,000 million turnover in 2006, and the market share in the world is 7% of the whole company.
Various challenges can be found as a result of testing for GlaxoSmithKline, one of them being the social factor. For GlaxoSmithKline, there has been constant criticism over the profit that they make, which is over £3 million, with many stating that it should be used to unite around a mission to improve lives where there are so many people dying in the darkest poverty in the world. As a response to this, GlaxoSmithKline now provides a social and environmental report which clearly states that corporate responsibility is an integral part of the business. It is inherent in the mission of the company. GlaxoSmithKline makes a significant positive contribution to society around the world through the medicines, vaccines and healthcare products that they research, develop and manufacture. Other factors that may affect GlaxoSmithKline include legal factors such as product liability claim, antitrust litigation and environmental concerns.
SWOT analysis of GlaxoSmithKline. Strength: comprehensive set of documents in the health sector, transparent public health and healthcare service purchasing, balancing finance in the health sector, and also established a track record of product development. Weaknesses: poor intersectoral relation between healthcare, public health and social care, rising cost sharing as an expression of inability to cope with the cost increase, and discontinuation of products in the later stage of development. Opportunities: social changes, economic growth, free movement of goods and services, and technological development, like for example opening labs dedicated to research for combating disease of developing world. Threats: raising population acceptation to the health system, and increasing the number of safety issues surrounding products, competition from products similar to GlaxoSmithKline in research and development that reach the market close to or before GlaxoSmithKline's product, counterfeit drugs being sold in a competition with the legitimate product, political pressure to sell at the prices that fail to pay for development of the new drugs or to recover past development costs, and increasing cost of drug trials and ever higher standards imposed by national drug approval bodies. For example, aspirin wouldn't be approved if invented today.
Porter's 5 forces for GlaxoSmithKline. Potential entrants. It would be difficult for a new entrant to get into this field because of the vast investment that needs to be had. Buyers. With GlaxoSmithKline's products being so important, it is difficult for buyers to have buying power, especially in underdeveloped countries. With corporate social responsibility in mind, we do need to let the buyers have more influence on the price that they pay for the products in order to be more socially responsible. Substitutes. It's difficult for there to be a substitute in the pharmaceutical industry because of the products that we create and the legislations in price. In developing countries, there are cases of counterfeit products being sold when the approved drugs cannot be purchased. Our suppliers. We have a US supplier diversity scheme which enables us to use smaller businesses to have competitive prices and know we are contributing to the economic success of those small businesses. This scheme should be introduced into the UK. Industry competitors. GlaxoSmithKline's main industry competitors are large pharmaceutical companies that have substantial resources. Our healthcare competitors are Pfizer, Novartis and Merck, and over-the-counter competitors include Procter & Gamble and Johnson & Johnson.
Is the responsibility corporations have to take for their social, ecological and economic impacts of their actions. GlaxoSmithKline follows a proactive and comprehensive approach to CSR and there are critical issues facing the company in the pharmaceutical sector. These are drug promotion and advertising and clinical trials. Other CSR issues that face GlaxoSmithKline are related to access to medicines in developing countries. These include pricing policy for medicines, research and development for developing countries' illnesses, and drugs donation policy. In 2003, GlaxoSmithKline developed a set of corporate responsibility principles and has become very clear about its CSR policies.
The recommendation for GlaxoSmithKline is to use the open systems model, which emphasises flexibility, external focus and stresses growth, resource acquisition and external support.